we have to be concerned about the mutants. Viruses will not mutate well if you don't give them the opportunity to replicate in a very large way. Namely, if you have an open playing field for the virus, they will replicate and they will mutate. The best way to prevent that is the implementation of the public health measures that Dr. Walensky just mentioned, both home and abroad, as well as the implementation of the administration of vaccines as effectively and efficiently and as quickly as we possibly can.
Cases and hospital admissions continue to decrease, and we now appear to be in a consistent downward trajectory for both of these important outcomes. While deaths have continued to increase, the pace appears to be slowing, with the average number of deaths increasing 1% to slightly more than 3,100 deaths per day from January 26th to February 1st. And the recent decline in hospitalizations gives us hope that the number of deaths should start to decrease in the coming weeks. Although we have seen declines in cases and admissions and a recent slowing of deaths, cases remain extraordinarily high, still twice as high as the peak number of cases over the summer. And the continued proliferation of variants that likely have increased transmissibility, that spread more easily, threatens to reverse these recent trends. Based on contact tracing and recent variant cases, not wearing masks and participating in in-person social gatherings have contributed to the variant spread. And this Sunday, remember, whichever team you're rooting for and whichever commercial is your favorite, please watch the Super Bowl safely, gathering only virtually or with the people you live with. The CDC recently posted guidance on how to safely enjoy the game. I would also say that safe reopening of schools is not, that vaccination of teachers is not a prerequisite for safe reopening of schools.
And you feel maybe more of a physical barrier would be better. There's nothing wrong with people wearing 2 masks. I often myself wear 2 masks. Can we make a general recommendation that doesn't have scientific basis yet? No. But when the science comes along and tells us that it is better or not, then you will see a recommendation being made by the CDC.
I think that is really our best barrier against these variants, is to do the masking and the distancing. And you will, more data will be forthcoming from the CDC with regard to the value of double masking.